It's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another question from one of my clients, and the question last week was part 7 of my sister is in ICU on a balloon pump and ventilated after cardiac surgery. The ICU doctors want to stop treatment against our wishes and let her die. What should we do? You can check out last week's episode by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer the next question from my client Emma, which are again excerpts from one-on-one phone and email consulting and advocacy sessions with me. And the question this week is part 8 of my sister is in intensive care on a balloon pump and ventilated after cardiac surgery. The ICU doctors want to stop treatment against our wishes and let her die. What should we do? You can also access previous episode of this one-on-one consulting and advocacy sessions with my client Emma from part 1 to part 7 if you're clicking on the relevant links below this video. And if you are watching this on YouTube, click on the link below this video. That will get you to our website where you can access all of our other free resources. Now, in today's series, or in today's episode of the one-on-one phone and email consulting and advocacy session with my client Emma, you will get real in-depth knowledge about cardiac failure in intensive care, how it works, the treatment and therapy options, how to wean somebody off the ventilator, and most importantly, you will discover how to not take no for an answer. You will witness how I can lead Emma in going from the intensive care team trying to coerce her and her family to agree to withdrawal of treatment as being quote-unquote in the best interest for her sister, to challenge that, and the intensive care team having to do everything within their power to save her sister's life and turning the dynamics upside down in Emma's favor. That's what happens when you have the right advice from a professional who knows intensive care inside out and who knows how to manage the dynamics and who can take the fear away of being intimidated by the intensive care team. So enjoy this consulting and advocacy session. Please scroll below this video where you can access and read the dialogue of this consulting and advocacy session between me and Emma. So, how can you become the best advocate for your critically ill loved one? How can you make informed decisions, get peace of mind, control, power, and influence quickly whilst your loved one is critically ill in intensive care? You will get to that all-important feeling of making informed decisions, get peace of mind, control, power, and influence when you download your free instant impact report now by entering your email below. In your free instant impact report, you will learn how to make informed decisions, get peace of mind, real power, real control, and so that you can influence decision making fast, so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. Sign up and download your free instant impact report now by entering your email below. In your free report, you will also discover how to ask the doctors and the nurses the right questions, discover the many competing interests in intensive care, and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle, and vulnerability, even if your loved one is dying. You will get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence in your situation. You will get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You will get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I will see you again next week in another update. You can also send me an email to support@intensivecarehotline.com with your questions, or you can call me. Find international phone numbers on our tab on the top of the website. Also, have a look at our ebook section where you get more ebooks, videos, and audio recordings, and where you can also get one-on-one consulting and advocacy with me via Skype, over the phone, or via email by clicking on the tabs on the top of the website. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.